MDMS or DNB? How good is MDMS or how good is DNB? Is it really worth to opt for DNB? What is our future if we opt DNB over MDMS? Why does DNB is so underrated? Is it really low when compared to MDMS? Why do people really have negative perception towards this DNB? What are the topmost hospitals in DNB and what is the pass percentage in DNB? Aren't these titles that you must have come around? Yes, I know you must have watched many videos regarding DNB on YouTube and must have many articles online regarding this DNB, and all those might have made you more confused and created lots of doubts in your mind. No need to worry, this video will make all that doubts get clarified and make your mind cleared, and also trust me, this video will change your perception towards DNB, the all stigma you are having towards the DNB. So don't miss anything from this video, watch till the very end. But before all that, you need to subscribe to my channel Dr.JTM and click that bell icon so that you won't miss any video from me. And with no delay, let's get it started. Hey guys, if you're new here, this is Dr. JT, General Medicine Resident and a part-time YouTuber, and I welcome you to my channel Dr.JTM. So this video will be having 5 sections which will be giving you complete information regarding DNB courses. First thing, my perception on DNB. First and foremost thing I wanted to tell all the PG aspirants is that DNB is not an inferior degree when compared to MDMS. Okay, because many of the PG aspirants start asking the same question, and many people who make videos or talk about MDMS or DNB will be stating like this: MDMS versus DNB. Is DNB really worth it? Let's start comparing DNB and MDMS. Let's cut all that. Why there is a competition between postgraduates? And it's not an object to decide its worth. And I don't understand why there is comparison between MDMS and DNB, which is actually creating a negative attitude towards DNB. Since ages, professors and few arrogant practitioners due to some egoistic reasons have downgraded DNB, and that's a long back stigma. We don't need to carry that stigma because now there is no comparison or differences between MDMS or DNB. All the postgraduates are equal and all of them are worth it. So let's change our perception towards DNB. Let's not be a generation of doctors who badmouth on our fellow doctors for no reason. So this video, I'll be only giving you the information, the right information to choose our right path for your better future. So this is not a comparison, but this is an informative video on DNB. Second thing, what is DNB and what is the structure of this course? Obviously, this is a postgraduate course called Diploma in National Board, which is under the control of Central Health Ministry and also National Board of Examination. So after you give NEET exam and you get your rank, you will be eligible to apply for the counseling online. That's where you will be filling up the options regarding the list of hospitals that are needed for you or that are good for you. Now the next question that will be popping up in your mind is that where you can get all the list of the hospitals that are available for DNB for various branches. Don't worry, I'll be telling you that in the middle of the video, so keep watching it. And why am I saying hospitals instead of medical colleges? Yes, you will be awarded a seat in government recognized hospitals that includes both government hospitals and also private hospitals. So the course will be for about 3 years where you will be trained both outpatient, inpatient and in emergency wards, and the inflow of caseload in most of the DNB hospitals, that is 80% of the DNB hospitals, will be very good. So you'll be having a very good clinical exposure as well as surgical opportunities, and you'll be having a skill-based training as well, and also clinical case discussions as well. So when it comes to the infrastructure, that is nothing but the equipment and also the diagnostic tools availability. The private hospitals for DNB will have very good equipment because that is a very stringent or strict rule implemented by Central Health Ministry and also NBA, and few government hospitals will have the high level equipment. So if you are looking for radiology or emergency medicine or any other branch, just have a look or inquire about the hospitals regarding this equipment and infrastructure. Third thing, academics in DNB. Yes, the most important thing is academic activities. What does that include? Journal club. That means the PGs and also professors will be discussing about few articles and also research papers on few diseases and also treatment protocols, so that we'll get some idea on evidence-based medicine. Then we'll have library and other journal access, seminars, case discussions and case presentations, and you'll be having CMEs, paper presentation, poster presentation, teaching and classes as well. All these includes the academic activities. So the DNB postgraduates will be having access to all these academic activities except for teaching and classes, because you are affiliated with hospital and not with medical colleges, so you will have very little chance of developing this teaching skill, and I say a small drawback. So regarding this, for medicine postgraduates, I'll be making a few videos on CMEs or paper and poster presentation, nothing to worry. And so the big talk about DNB students not having proper academic skills is false. They will have academic activities, but only up to 80%. Fourth thing, exams and pass percentage. Yes, exams in DNB are really tough. The paper will be really tough, and practicals are also very tough, because after you write the theory exams, if you pass, then only they'll be allowing you to practical examination, unlike MDMS exams. And after you get the result, you will be going to another institute for attending for the practical exams, where you will not have internal examiners, only external examiners will be there. That will actually make the exam bit tough and also unbiased. So when it comes to pass percentage, it is very low, I should say, but in the recent past 5 years trend, this pass percentage has been slightly increasing, because in 2021 the pass percentage for DNB students in medicine is 73%, obs-gynae 90%, surgery 68%, ENT 37%, orthopedics 18%, which is quite low. This is the biggest fear for DNB students, because if they opt for DNB and if they get stuck inside this DNB without getting passed, that is the fear making them to set back not opting for this thing. But there should be a fair and clear thing regarding the exams or pass percentage, because are the students really not preparing well, or NB is having any evil plot behind this? No one really knows. Fifth, career options in DNB. Yes, the career options for DNB students will be really bright, and yes, the earnings will also be very good, because DNB students or DNB postgraduates will be having a good chance if they opt for practicing medicine in peripheral institutes, or the regional tertiary hospitals. But if you wanted to work in medical colleges, that's the main issue, because those institutes consider teaching as a major aspect. Then you will be having a second priority. But if you wanted to work abroad, then definitely you will have higher preference, because the level of clinical exposure you have or the clinical knowledge you have will actually attract them. In the same way, you are qualified to give any super specialty exams, as well as you are qualified to apply for all the fellowships that are being offered across the country and also in other countries as well. And I know the last question, where you can get all the list of DNB hospitals that are good in different branches. No need to worry, I have made a PDF of all the DNB hospitals that are good for various branches, and link to download that PDF is given below in the description. Go get it. And also, if you want more information regarding DNB, I have found 2 really good websites where you can get a lot of information. Links to those websites are also placed in the description. Go check out and get your doubts clarified. So that's all for today. MD, MS or DNB, both are equal, and all the postgraduates are worth it, because until you keep learning or treating the patients with quality, the perceptions of the people doesn't really matter. All that matters is the confidence that you have that you could excel in any branch or any college that you practice medicine. So let's keep all that stigma behind and move ahead. All the very best and have a bright future. And if you love this video, don't forget to like, share and subscribe to my channel Dr. JTM, and I'll be back with another great video. Until then, bye, take care.